What changes a system that has let, in a sense, mental health get into the state that it's got in terms of parity? And my 4 top things are, one is leaders. We have to have leaders across the system who understand mental health, who are informed about it, who have negotiation skills, who know what good looks like, and we have to skill them up. As one practical example, the 211 CCGs in the country will be starting their mental health leadership competency-based program quite shortly. That's one set of leaders. But we have leaders in the strategic clinical networks, we have people like you in the room. It's galvanising all of those people. The second thing is getting the facts. Local authority by local authority, CCG by CCG in this country. What's the level of need? What is the current level of access to services? What are the waiting times? What is the quality and the standards? And what's the spend? And what are the outcomes? What's the value of that spend? The third thing, and this is the bit that I think gives me the most joy, is we have to know what does good in the new world look like? What does integrated care, parity in the relationship between the service user and the clinicians and the professionals, what does integrated care look like? I think the mental health world is innovating. Everywhere I travel around the country, I am seeing the most amazing innovations. And what we need to do is to find a much better way to disseminate them. The fourth thing we have to have is a communication strategy. I think I've seen a real sign in the last week or two that the tide is changing. So my comm strategy has been to say, please let's not talk about mental health as if it's some big blob. Let's have people feeling as able to talk about their eating disorder problem or the depression or when they had a blitz with alcohol or when the OCD got worse. Let's have people talking about their conditions and what it meant to them and what the treatment meant and what a difference it made to their lives when they got it. Now, Nick, the Deputy Prime Minister, I think it is probably just about 10 days ago, announced the Bridging the Gap, moving forward faster for mental health. And one of the things he talked about was communication and people being able to tell their stories. And the very next day on You and Yours, I don't know if you ever listened to that programme, but I was asked in my role, would I come on and I'd probably have to do 5 sound bites. I only had to do 1. 100 plus people rang in to talk about. I was at university. I developed an anxiety disorder. I had to give up my studies. It took 18 months to get treatment. I got the treatment and oh, it's fantastic. I'm back studying. I'm back on track. A man saying I had major employment stress. I became depressed. I couldn't work. I lost my kids. I went into debt. And then I got the treatment and now I'm back at work. So it was a complete myth buster. It was people feeling as able to talk about a hip replacement as an eating disorder. It was people saying, we have a mental health problem. That does not mean we want to be on benefits. It does not mean we don't want to work. We do. We want the treatment and we want it earlier. And I think that's probably some of the best messages that we can get out there. We've had monocular vision. We worked on the basis that this is somebody's body and that's somebody's mind, and they don't interact. And let me tell you that internationally, we are now being regarded as a little odd. It's that very strange British stiff upper lip thing getting in the way of evidence-based healthcare. So if you go into an American cancer unit, you'll have your assessment for radiotherapy, chemotherapy, and you have your psychologist assessing and helping you think about, so how are you going to work with this illness? You'll have a stroke. You'll have somebody helping you think about psychologically how you're going to tackle that. So in some ways, we really do need to get past this incredible monocular physical or mental vision that we let creep in. I don't ever believe that any one of us or any one organisation alone can achieve what we need to in mental health. So what I'm going to talk a little bit about is the system partners. So when we think about changing the system for parity, what we have to do is to think about who's acting in each of these organisations going forward. And then I don't want to talk about one direction, tempting as it is for possibly some of the younger people in the room, but I'm going to talk about the 3/3 direction. First of all, we're looking at, so what are the causes of mental ill health? What are the causes? How would we build people's health literacy to help them build their resilience to prevent them from becoming ill? And prevention, what does prevention look like? The second third is thinking about people with who need the kind of primary care, however we're going to define primary care. Are we going to define primary care as frontline general practice, frontline pharmacy, frontline social care, frontline mental health services care? How are we going to define primary care? And then thirdly, the people with the really severe, difficult, complex difficulties. So what are the evidence-based interventions that we want to be promoting? Well, first of all, there's employment. We know that a third of all the people that go to primary care with depression, anxiety, and work stress are there because of poor employment practice, not implementing evidence-based practice. We are having a real push to see how can we promote, with time to change, healthy employment practice. Schools. We know that 50% of all mental ill health begins before the age of 14. Therefore, where do we need to focus a lot of our efforts? Answer: with children. What can we do to make sure that in every school there are programs and courses on building your psychological strength, understanding your resilience, school nurses trained in mental health, form tutors trained in mental health, governors advocating for mental health? London's a young city. Is London a place to kind of take a lead in this? If you're thinking about how you can commission and how you can support commissioners and what you can think about to improve mental health, these are the 7 outcomes. Increasing life years, improving quality of life for long-term conditions, avoidable admissions, how can you get that to happen, increasing more people living at home safely, and having positive experience of health and community care, and avoiding premature deaths and avoiding deaths in hospital due to poor care. So that's kind of the guidebook of what you need to think about when you're supporting local commissioners achieve their outcomes. I think it's probably fair to say that in this country, for quite understandable reasons, we just, throughout the 1980s, major liaison with primary care with the bathwater, and it's time to get it back. If I go anywhere in the country, where I hear the most service user outcome, exciting, innovative, let's do something movement is in primary care mental health. First of all, people are working on the demand management, first, third strategies I talked about. Secondly, people are taking on board what happens in Hungary, Scandinavia, Eastern Europe, and training a whole team in suicide prevention, and not expecting that in a 10-minute consultation with a GP, that's going to be able to solve it all. Much, much more whole team system thinking. And in most places across the country, people are now looking at IAPT plus, employment specialists, benefit specialists. And finally, again, and certainly in Oxley's, I know this is something we're doing, is helping primary care by saying, who are your top most frequent attenders at A&E and have been admitted, and let's have some virtual case conferencing to kind of help address that. There is an absolute wealth of things happening across the country, and if we just can find a way to get some of those good ideas out to you, I think that would be really helpful. So thank you.